Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population of the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
figure out other options.
Obviously, you thought about that.
Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump.
A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm not trying to be evasive,
let me
Senator.
ask you this.
I'm just telling you I don't know the answer
I appreciate
to that question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we have a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken.
Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right.
Yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. And so are you guaranteed the same right, or is there also a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. I think the gist of what you're trying to say today is you're really pro-vaccine. You want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with leadership.
Are you supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science, and I want to protect the
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics.
Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from President
Chairman,
Trump
you're saying I'm running out of time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question.